Hello and welcome to episode 33 of Tom's Hirschsprung's podcast. Got something a little bit different for you today. We are going to talk about something that's very rarely talked about ever, really, in endometriosis. And joining me to talk about her diagnosis story is Rebecca Johnson-Richards. Welcome, Rebecca.
Hello, hi.
Hi. Thanks so much for coming on and for being willing to talk about this, because this is something that I know we were sort of talking off air, something that I didn't really know a lot about at all, but actually affects 1 in 10 women, which is enormous. Certainly when we're talking about chronic illnesses, that's a huge number. Would you like to sort of kick us off with your story and sort of starting around about sort of 11, 12 years ago, when you were 15 years of age and starting to sort of feel probably the first signs of endometriosis?
Yeah, sure. So, I've been a hairdresser since I was, well, not fully qualified, but I've been hairdressing since I was 15. So, I started with like really bad lower back pain, weirdly knee pain. It's like a lot of different things like that. And obviously I went back to my doctors. They sent me for an MRI. They found there was nothing wrong with my back, but they found like an ovarian cyst. And essentially I just got told I'll be fine. That's it. And just to carry on with that. And then obviously I was going back to the doctors for like other little things alongside like my back pain and things like that. And I sort of didn't really know myself at the time, and I was trying to like look for something why I was in so much pain, because at this point I think I was taking naproxen, which obviously very strong, but I didn't have like an actual direct reason as to why I was suffering. And it was sort of like, it was floated past me, because one of the girls I worked with, she was kind of going through a diagnosis of endo as well. And it kind of clicked, and I thought, well, is it maybe polycystic ovaries or anything like that? And again, like the doctors were just sort of like, oh, you need to do exercise, you need to do this, you need to do that. Well, you know, I was young, was fit, I was on my feet all day, so obviously like exercise isn't really going to make a massive difference. So I just kept going back, and then it was just obviously like severely heavy periods. It was just like obviously a lot of pain and the painkillers and things. And again, my doctor was just like, oh, it's just heavy periods, you just kind of need to get on with it. Until sort of like properly, it was 2022. My GP that I'd seen was a new GP actually, and funny enough, obviously within the endo community there is a little bit of a, what's the word, it's sort of like taboo as such. You know, if you have a male doctor, they're not going to understand specifically about these sort of things, which is understandable. But my doctor, he's amazing. He's done everything he could possibly do for me. I went to him with like a literal book of like symptoms, and it was just like a long list. And I just said, like, this isn't normal to be in this much pain. And obviously my pain was gradually getting worse and worse. And he was like, right, I think it's endo. I'll refer you to general gynae, which now I've had 2 surgeries. Going back to that, I wish I'd asked for a specialist, but obviously you don't actually know. It's not like common knowledge to know that a general gynae can't find endo, and they also can't remove it. So I went to see the general gynae, obviously got referred for surgery, had the surgery. I was told I was perfectly healthy, absolutely nothing wrong with me. Like, that's it basically, just to carry on. And obviously afterwards I was quite relieved. I thought, okay, great. But then I thought, well, hang on, like, there's no explanation for why I'm so much pain. At this point I was taking cocodamol, So again,
Wrong.
yes, yeah. So then alongside that, obviously, I went back to my GP and I said, look, like, I know it's like it's good news, and obviously, like during this time, I was having blood tests, I was having MRIs, ultrasounds, everything you can possibly think of, and nothing was coming up on anything, and I was like, okay, well, partly this is good for me because endo cannot be seen on ultrasounds, MRIs, or anything unless it's deep infiltrating endo, which is obviously just like a lot worse. So of course, like they never actually found anything. So my doctor was like, okay, well, I'm not happy that you've had this surgery and nothing's been found because there's a reason as to why you're in so much pain. There's a reason as to why you're taking these painkillers. And I was like, I'd rather not be taking painkillers. Because obviously at this point, I was, what, I don't think about how old I am. I was like 20, 21 sort of, and like I was like, I don't want to be feeling like ill because of painkillers as well. I hate the side effect.
Yeah.
So I actually asked to be referred to a specialist. In July last year, the specialist went in, did the surgery. Obviously, I was terrified. I was so scared in case I was going to wake up and be told that there's like nothing wrong with me, because I was like, I'm surely not making this up. Like, I feel like I'm going crazy. And obviously, like, you wake up in recovery, and at first I was like, oh, I'll not ask. And then I just had to ask because I couldn't wait. And she was like, the nurse, she was so, so kind. She was like, they've found endo and they've excised it. I'm so proud of you. And I was like, oh, thank you so much. Like, such a nice thing to say, isn't it? Because obviously it is quite traumatic having to go through the surgery, but they found it on my left abdominal wall, my right abdominal. They found it on my sacral ligament in my back. They found it between, it's called a UV fold, which is basically, it's just space between your bladder and your uterus. They found cysts that came back as endo on my fallopian tubes. Where else? It was pretty much all over, I said.
Oh, yeah, it sounds like it's a great deal.
Oh, yes, and he said my uterus looks adenomyotic, which adenomyosis is basically the sister disease to endo, but they can't physically cut it out. Obviously, there would be like a hysterectomy to remove the uterus, and that's basically where I'm at now. Obviously, when the difference between the surgeries are, they can do it's obviously diagnostic laparoscopy. They can burn away the endo or they can excise it. Burning away doesn't really offer any relief because it's more than likely going to come back pretty much straight away. Although for myself, excision, I had about 6 weeks pain-free, and then it's obviously come back, and now I'm on tramadol, pregabalin, and paracetamol. So that's basically it, essentially.
Less then.
Yeah. But yeah, that's just basically where I'm at now. I'm waiting to see a specialist. I've been waiting since January. I don't know where he's at because the specialist I've seen last year has apparently left. So yeah, so I don't really know what's happening there, but it's what it is, really.
Okay. Well, thank you so much for sharing that. And there's a couple of questions I have, and I guess I think doing my research on endo, that there is a really long wait for diagnosis, and I mean yours was roughly a decade or so, and I think people might be a little bit shocked to hear that that's fairly normal.
Yeah.
In terms of, so sort of how hard did you have to sort of really fight to go, I know something's wrong with me. I know Did you think it was endo? I know you said you went with a list of symptoms.
Yes. Yeah, so it's been like I wouldn't want to have to go through it again, the fight, and I do feel for women who have to, because like there's just so much you have to build your own sort of case about it essentially, and it's hard because, like I say, certain doctors would just kind of brush it off. So having like a supportive doctor, like I say, does make a difference. But essentially, I'm trying to think. I've literally got a folder with like all of my hospital letters, all of my symptoms, just everything, just to back myself up. And as far as like the way I had to go was when I had my first surgery with a general gynae, I went to him with, like I said, a list of symptoms. But what I did was I actually did a day by day like diary entry, marking my pain out of 10. Obviously like symptoms as well, because it's not necessarily like, because the people seem to think that it's literally based around your cycle, and sometimes it's not. Your pain can be just like, I would say 3 weeks of a month, I'm like in pain. 1 week I might not have pain, but I might have a migraine. I might have, like muscle aches and things like that. So within that, I did obviously I wrote all of that out, to obviously advocate for myself. I actually requested, from my first surgery, the images, because I wanted to see for myself, because obviously again, you have to research it all yourself as well. There's this guy I follow on Instagram, and he's so good. He's an endo surgeon, he's like a specialist, and he actually shows him doing surgery and showing like the endo. So obviously I looked at my photos and I found, okay, I can see endo myself. So I was like quite baffled by that. But it's literally just, I was like at the doctor's every week. At this point, I was like, I think I've got water infection. This is happening. And it just started to build up and build up. And you've just got to essentially like find out for yourself, really, which is really frustrating. And it is such hard work, because I had so many people being like, well, there's nothing wrong with you. Why do you want to like have something wrong? And I'm like, well, I don't. I just would prefer to have an answer, like essentially, like, but like I'd went to I was going to acupuncture for about a year before my last surgery. Actually maybe longer, to help try and treat it. No, it was definitely longer, because after my first surgery I had, obviously I had the diagnosis, and I was like, oh great, well, sorry, I didn't have the diagnosis. Like, okay, great, well, the acupuncture's been helping. And then obviously I still continued to have that. And then I had a surgery literally a year later, and the endo was found all over, and I was like literally, this just goes to show, like, there's nothing that can physically help it. But the main thing I would want to say for like other people especially is, if you do think you've got it, ask just to see a specialist, because I just think it is a waste of time going to see general gynae, for one, because they're not equipped to rule that they can't. And then number two, I just think like, obviously if you have that option to go straight to a specialist, it does cut the time down a little bit, I'd imagine. But I think it's partially because obviously they have you going through all the tests, but then they have you on every single contraceptive. Because they're like, oh, this will minimize the pain, this will stop your period, so then you won't get anything. They try to put you into, like, I got offered the injection that puts you in a medical menopause.
Okay.
Obviously at my age I do not want to have that, because I just don't know what can happen later on down the line. But yeah, that's essentially what they do. They do like, they push a lot of things like that before they do a diagnostic laparoscopy, but you've got to like be quite certain about it, and you've got to go with your facts, essentially.
Yeah, definitely. I mean, it sounds like you did an awful lot of research beforehand. And there's one point I do want to pick up on, which is kind of advocacy for yourself. Obviously, you fought and fought and fought and fought. And I know we sort of know each other from something that we used to do. There's very much about advocacy and advocating for other people. But I think, how important was that for you to think, right, I need to keep going and going and going, and I need to find an answer, even if I'm told, it's going to be, everything's going to be fine, there's nothing wrong with you, etc., etc. How important was that for you to just go, right, I need to keep going, keep going, keep going?
You know what? I think it was because, like, part of me, obviously, later on down the line, I would like to have children myself. And I just think, if I had a daughter and she suffered like me, and I didn't do anything about it to help myself, then how could I help her? And I just think, I mean, obviously, it's not, I mean, hopefully, I really hope to God that she doesn't ever, if I do have a daughter, she doesn't have endo. That's my main thing. If she does, I've got the right tools to be able to like advocate for her as well. And it's also for other women too, because obviously within my industry, I work with a lot of different clients and people, and mainly women, and we discuss these sort of things, and just getting the word out so people kind of understand like the actual impact it has on your life is so important to me. And like, I just think it's so easy to take it as a negative, of course, and be like, this is awful. Like, and I have this, well, as soon as I got my diagnosis last time, I went from like quite a high to a low to think like, okay, this is my life. This is how I'm going to be for the rest of my life. Unless I have a hysterectomy, but there's no guarantees that's going to help. But then I thought, you know what, like, I could help other people. If this just helps one person, then that means a lot. And I just think, like, it's good to, like I say, I touched on it before, but I think, like, teaching young girls and boys, actually, to be honest, that it's not okay to be in this much pain. You're not actually supposed to have any pain. Like, apparently, from what I've heard, is sometimes, like, some people just have to take a paracetamol and that's it. So, and some people just don't even need any pain relief at all. And it's like, people just only think, oh, well, you're supposed to be in quite a bit of pain with it, and you're supposed to be bleeding quite heavily. You're not actually supposed to at all. So that's just my main reason why.
Yeah, no, very, very much so. I know you mentioned about doing lots of different activities and etc. I'd like to change tack slightly and talk a little bit about your hobbies. Because if anybody has seen your Instagram, they will know that you're very keen on embroidery, very talented on.
Yeah. Thank you.
How did you get into that?
I'd seen on TikTok, of course, the
fountain of all knowledge.
Yeah, of course, all the info that you get from there. This girl had embroidered like a t-shirt with like these cherries on, and I was like, I ruined quite a lot of my clothes at work with bleach and everything else, So I seen it and I was like, oh, that looks quite interesting to do. And I had a denim jacket that I was like, either going to take that to charity or bin it. I thought, sure, I'll make like use of it, give it a little bit of a new life, and just started doing it. I watched one video and did it. But I find it quite like therapeutic. It switches my mind off as well, because obviously alongside like with a chronic illness, I suffer with like anxiety. So obviously like I'll be worrying about just everything. So yeah, that's how I started it. My mum, like my mum's always been like quite well, she taught me how to sew when I was younger. She's always been into sort of that sort of thing. She used to make like miniature dolls for people to like collect. They were like porcelain dolls. And then now she does like a lot of like needlework as well. So I suppose, yeah, I've just picked that up off her really.
Fantastic. And I think that's a really important point you make about it being a sort of distraction from pain. Because obviously, with my illness, I can relate to that. I've had a lot of stomach surgeries, a lot of pain, and doing something crafty or sort of artwork or something like that would really, really helps me. And going, I mean, I'm not talented in the slightest in craft artwork. I can't draw, etc. But just doing something to take your mind off. I mean, the pain is still there, but I've found that really, really helps me. That if I'm doing something, it can help a lot. I know you said with the anxiety as well. Was part of that sort of waiting for the pain to arrive as well, or was it?
Yeah, yeah. I think because again with endo, because of the way it is with your hormones anyways, it's bound to give you a form of anxiety anyways. But I just sort of think, yeah, like I used to, I mean now it kind of just hits me, so I don't really like have time to probably think about it. But sometimes I can start off being like a little bit of pain, I can feel it, and then I'm like, oh my God, this is gonna get like, I know this is gonna get worse. And I would expect it to. So yeah, it is obviously it just alongside that, but it's also I find like social situations I get so anxious about because I'm like, I don't know what my pain's gonna be like. I don't know how tired I'm gonna feel. So it obviously affects us quite often too.
Definitely. But I guess as well, keeping active. And it's interesting that, again, reading your article, that one of the ways that they thought they would help is by saying, "We'll just do some more exercise," which just sounds really, really generic to me. I mean, I think we all know, exercise, moving, all of that, really, really good. But I think that just sounds incredibly generic.
Mm-hmm. Yeah.
What did you sort of think at the time when they said, "Oh, yeah, just do a bit more"?
Honestly, right, like the doctor, I literally watched her type in on Google exercises, and I was like, why am I here? Like, great, cool. I just thought, like, when I was younger at first, I thought, well, that's just rude. Like, I don't really need to do exercise. As I've got older now, I know that I have to be so careful. So I have to do like low impact exercise and things like that because it can just kick a flare off. Because like I say, I have no control over it. So I just think it's honestly it's a ridiculous thing to say. But like you say, I think it's just a generic thing. I think they just say it because they don't know themselves. And I think because they haven't got an answer for it. And, obviously your GP is just a general practitioner. They can only do so much. You don't specialise in a certain thing. But I just think like, for me as a person, I wouldn't even ever dream of saying something like that.
No.
But
I think, yeah, I think it's it sounds incredibly generic. And I know, just sort of wrap up a little bit, but we talked at the start about it being a sort of 8 to 10 year wait. I mean, the average in the UK is 8 years, 10 months for a diagnosis. And in the same article, the government has said that they would like by 2030 for it to be down to a year. How possible do you think that is, having been through it yourself?
You know what? I actually do think it is quite possible, because I think if they cut out a lot of the things that they do, then it would probably make more sense. Because for myself, personally, I've found no contraceptive have helped my pain. It's actually accelerated it, made it worse. And again, from doing research myself, it doesn't actually, like, there's no like research, or there's no sort of like evidence based that any of the contraceptives actually help. I mean, personally, some people have had the coil, I've heard, obviously with being and having my Instagram. And they have worked for some people, but then some people have found it hasn't, or it's just kind of like the side effects as well are worse. So that cutting a lot of that out would make a lot of sense. If they were to have a look at it, there's literal books that you can read that I've been reading myself that literally give you a table of what the contraceptive does to endometriosis, essentially. So there's that. And then I think, like, you know, if it's not showing up on blood tests, and I think if it's not showing on maybe like an ultrasound, I wouldn't, like, 9 times out of 10 doing an MRI is a waste of NHS's money and time, because you know it's not going to be found then. And of course, as I said earlier, I just wouldn't even go and see a general gynae, because, like I say, they know the basic. And that's it. I mean, like, a general gynae probably, I mean, I've been told this before, is, oh, we'll get pregnant, it'll cure your endometriosis.
Really?
Yes. And I'm like, oh, okay, yeah, because that really gets rid of scar tissue, but, you know.
Okay.
But yeah.
Okay.
I do think that if they put more time into researching it, and it's not necessarily like researching the scientific side of it, it's literally speaking to women who have endo. We know so much about it, we've had to. And it, I mean, to a certain extent, I'm so in tune with my body. I'm like, before I went into my surgery last year, I was like, this is where my endo is, and I know it's here because this is how I feel. And I came out and I was like, I knew it. I was like, actually knew it. So if they literally spoke to women, then it would make sense. And there's such a repetition of women having gone through all of this, and every woman that I've spoken to, it's took 10 years at least, like you say, to get a diagnosis. So like, it just absolutely makes no sense to do everything, just cut out quite a few of those things, saving the NHS money and also the patient time, and then just skip to that. It would just make more sense, really. But yeah.
No, that sounds like a very sound plan to me.
Yeah.
Like that doesn't seem to have any flaws at all. But no, thank you ever so much for sharing your story. And just as we sort of wrap up here, I know you talked about your Instagram, and there's a lot of really sort of useful stuff about your journey and everything on there. In the future, what would you like, sort of, I know you're an advocate for endo. What would you like that to look like, sort of, in the future?
Do you know what? Like, I'm really, really grateful for opportunities that it's gave me on my Instagram. I only set it up over a year ago as well, and I think, if anything, I just would like to be able to get my story across, which obviously I've been able to do with quite a lot of things. But my main thing is obviously to help other women, and be supportive of them, because it during the time I was going through my diagnosis, it was quite lonely, because obviously, yes, you have the support, but it's so hard because people don't understand, like, what it's like to sort of be told you're perfectly healthy when you're not. So for me, like, I just love having my Instagram because I get every now and then I'll get like a little message of someone saying I've been following your account. You don't understand how useful it is, because you gave me like the tools to be able to go to my doctor. I mean, I've had clients, like one of my clients, she messaged me saying, what would you pack for your surgery? And I was like, oh, look, I've done a video, and I'll send like a message about it, because to me, I just think like having that support and having someone there just to be able to give advice is the most important thing. But I definitely think having the community is really, really good, because I've made some really good friends through it as well. So that's mainly like my main reason, is just to be able to help others, and hopefully in the hopes that obviously, even if I'm just a small part of their journey, that's a big thing to me.
That's huge. No, that's fantastic. And where can people find you on Instagram?
So it is Rebecca's .journey_, I think. I can't remember. It's you can just type my name in, Rebecca Johnson Richards, and you'll find me. That is literally, I post everything on there, the highs, the lows. I've posted my surgery photos as well. Just because, again, I think it's interesting for people to see, and if they wanted to, they can literally compare. But yeah, that's where I am. I think that's my account. I actually can't remember the name.
It's all right. I've just checked it whilst we've been recording. It's fine. It's Rebecca's.journey_.
There we go. So I was right.
If anybody wants to follow Rebecca, a journey, inspirational message, and some great embroidery work, if you want to have a look at that as well. But just from me, thank you so much for coming on, for sharing your story. And I wish you all the luck in the future.
Yeah, thank you so much for having me on. Thank you, Tom. I really appreciate it.
My pleasure.